Sleep apnea is something that we see as a pretty common phenomenon, especially in aging, and tends to be more in men than women. And of course there are relationships with various other risk factors such as obesity, being overweight, and often in men you'll see they have a very big thick neck or quite short neck, and they can actually have physical reasons for sleep apnea. And sleep apnea essentially is a situation where overnight, during sleep, the airway gets blocked off. And this is often because the tongue falls back and obstructs the windpipe. And this is something that, as I say, is incredibly common in society in general. And the question has been asked, well, what about in patients who have things like Parkinson's disease or other brain diseases? Do we see it more commonly? And the answer is, again, the studies that have been done have not shown very clear evidence that those diseases seem to be associated with much higher rates of developing obstructive sleep apnea. The other question that has been posed is the question of, well, what about sleep apnea's effects on the brain? So if you like, turning it the other way around. We know already that sleep apnea can put strain on the heart, and we see the cardiologists all the time looking to exclude sleep apnea as a thing that would make the heart worse. But also people are turning their attention now to the idea of whether sleep apnea, where you're starving the brain of oxygen for periods, repeated periods overnight, can cause an increased risk for developing dementia. Now there are some studies that are available, they're large population-based studies where there are hints. Interestingly, in women, sleep apnea may be seen as a risk factor for developing dementia. Those studies aren't completely conclusive at this stage, but certainly the idea of having sleep apnea repeated episodes during the night isn't going to be good for you, and certainly not good for your brain. There are implications, I say, with regard to your heart, and also just with impact on things like your concentration and your level of sleepiness the next day. So again, it's one of those symptoms that I think if you are concerned about your overnight breathing, so if your partner is saying to you, look, you're snoring heavily, especially if you're lying on your back, or your airway is blocked and they can hear you stop breathing for many seconds and then a gasp. These are all warning signs that you in fact may be someone who is suffering with sleep apnea. And if you then find you have other symptoms like being sleepy during the day or a headache in the morning, these can all be features that are actually very common in sleep apnea and should direct you to getting specialist help.